Birth control can be used for many different things, but preventing pregnancy is the biggest one. There are a lot of different birth controls out there, and sometimes finding the right one can be kind of difficult. So we're going to jump right into it. Some of the types of birth control I'll be talking about is Nexplanon, which is the implant that goes in your arm, the pill, which is pretty self-explanatory, and the Depo shot. So the first birth control that I'm going to be talking about is Nexplanon, and that is the bar that goes in your arm. The effective rate on this one is about 99% effective if it is inserted correctly, and that is the really big thing because sometimes the bars can bend or snap, and that causes them to be ineffective because they aren't placed right. You can use this particular kind of birth control for 3 years before you have to get it removed and get a new one put in. The way that this birth control works is that it stops your body from releasing an egg. And if your body doesn't release an egg, then obviously the egg can't be fertilized. Therefore, no babies. Some of the side effects with Nexplanon, the biggest one, I used to have this birth control, and I did a lot of research on it, and the biggest side effect that people have talked about was changes in your menstrual cycle. So it can either be longer or shorter. Some people continuously bled with Nexplanon in, like it never stopped. And some people it just completely cut it off to where you had nothing. Another side effect is mood swings. Some people get really, really, really bad mood swings with this particular birth control. I'm not really sure why, but that is one of the side effects. You can also gain weight with Nexplanon. It's not like a super common one, but it is something that definitely happens. So for the cost of Nexplanon, without insurance, you could pay, or you could get charged almost $1,000 just to get it inserted. It's very pricey if you don't have insurance, but with Medicare insurance, most of the patients paid little to nothing. They didn't have to pay any out of pocket. But for those who had Medicare and it didn't cover all of it, they paid $3 up to about $936 roughly. So even if you have insurance, it can still be a pricey birth control. So the next one that I'm going to be talking about is the pill, which is exactly like it sounds. It's just a pill. You take it every day. The effectiveness of this one is overall 91% because there are chances that you're going to miss a pill on accident and all of that stuff. But if you are 100% like right on every single day, it's going to be 99% effective. But most people tend to miss at least one pill here and there, which brings it down to 91% effective. This, with this particular birth control, it takes 7 days before it starts working, like fully. So as soon as you take your first pill, you have to wait up to 7 days before it is fully at its full capacity and working properly and the way that it should be. The way that this particular birth control works is that this pill stops you from ovulating, and ovulating is when you drop an egg, which then the egg would get fertilized. So this birth control completely stops you from ovulating, so you never have the chance to drop that egg. So the side effects of this birth control, one of the most common ones is bleeding in between when you're supposed to have your periods. So like spotting here and there or stuff like that. That is one of the most common. Another very common side effect is headaches. Some people get really bad migraines with this birth control and stuff like that. And nausea is also a very common side effect. It just makes you feel sick, especially if you're starting, like when you first get it, they say that you feel really nauseous because your hormones are changing and your body just has to get used to what you're putting into it. So some of the benefits of taking this pill is the pill helps with acne. It can help clear it up or stuff like that. So that's a really big one. The pill is also commonly used to regulate periods. So I know a couple people that had the bar and it caused them to, their periods be super irregular. So they got on the pill and the pill helped regulate their periods and made everything normal again. Another thing it helps with is iron deficiency, which is anemia. So it helps either prevent that or make it not as bad as it would be. So finally, I'll be talking about the Depo shot. The Depo shot is exactly what it sounds like. It just gets in, you either get a shot, it's a shot, that's all it is. So with that one, it is 99% effective. And it works for 3 months at a time, so you have to go back to the doctor every 3 months. You get a total of 4 shots a year just to keep it going. And the Depo it works the exact same way as the pill does, it's just in a different form. Some of the side effects of Depo is weight gain. The Depo can cause you to gain a lot of weight, and that is one of the biggest side effects that happens. Another side effect is it can cause blood clots. So your blood just clots up, and that's also another super common one. The shot can also cause increased depression and anxiety, or even bring it up. So if you don't have it, you can start getting forms of that. And the benefits of the Depo are it's very convenient. You go in every 3 months, get a shot, and it's done. You don't have to worry about it until that 3-month period is up. It isn't overly expensive, so if you're on like a fixed insurance, it's super good for that. There is less chance that you will forget to get it, forget to take it. And some of the and there's a lot more birth controls out there, and all of them have different ways of working, and some of them are more effective and least effective and have different ways. Your body just has to get to know them. Birth control comes in all shapes and sizes with many differences in all of them. Finding the right birth control might take some time, but if you look into it and do your research, you should be able to figure out which one works best for you.